Fear and panic is a real issue right now as the coronavirus COVID-19 continues to affect people around the world. Today we have a clinical psychologist joining us to tell you how you can remain calm. Dr. Andria Spyridou is here. She's the mental health and psycho support coordinator for International Medical Corps. Thank you so much for being with us.
Thank you for having me.
Tell us, what is your role at this time?
So International Medical Corps arrived on Grand Bahama Island right after Hurricane Dorian in an effort to support the relief on the island. We were providing medical support, working together with the Grand Bahama Health Services. And we've been doing so until now, and we will continue to do so. However, we are now trying to step up our activities and tailor them to this new pandemic that unfortunately has reached the Bahamas. So we are looking into sharing information on the different stressors and the anxiety that might come to people when they are faced with such challenges. A lot of fear is around this topic because of all the negative news that we receive on a daily basis around the world, and this can create panic in the people, for sure.
Are you finding that people are panicking and are fearful as a result of COVID-19?
Well, I think that here on Grand Bahama, I see that there are still people that are taking this very relaxed to the point that they might not be following the advice from the health services and the Ministry of Health, which is a negative reaction because then it means that they're not taking the necessary precautions to avoid contagions. And then I also see that people might start fearing because of already the health services that were impacted after Dorian, and how the fear of how they might be receiving treatment in case people fall sick. There is a lot of misinformation still going on. There is a lot of awareness that needs to be raised. But we know that in any epidemic, it is common for individuals to feel stressed and worried. And common reactions are the fear of falling ill and even dying. People might start fearing of losing their livelihoods because of measures imposed, fear of being socially excluded or stigmatized even. Especially for those people that need to care for others, they might be even afraid to, in order not to contage others, they might be avoiding to go to the people in need, like people with disabilities or the elderly that need to be taken care of.
I think we take it for granted that doctors and nurses and those in the medical profession, they've been working almost 24 hours to ensure that people are safe and they are healthy, and to do tests. What should they be doing to ensure that they do not become overwhelmed?
Well, unfortunately, this is something that we've seen in other countries, like in Italy or in China, doctors and the whole health system becoming overwhelmed with all the burden of the people that become ill. And what is important is a good preparation for them, first of all, to feel safe, that they have all the needed material. And International Medical Corps has already distributed in all the community clinics on the island surgery gowns and protective masks, and we are planning to also bring more in. Then on the other hand, people who are working as on the front line, they might also be afraid that they might get sick themselves. They work, as you said, many hours, so as a result they don't have time to take care of themselves but also of their families. They might be worrying that they won't be able to continue working if they fall sick, and they see the burden when people come in and they need health care. So I think what we all need is to first of all appreciate that, acknowledge their hard work, trust in them because they're here to do the best they can to take care of all of us. And also respect that they might be tired, they might be overwhelmed, they might be also stressed. So in every opportunity we get, we should acknowledge that and thank them for their hard work.
When people become overwhelmed, because after watching the news or being on social media, any one of us can become overwhelmed at any point in time, what do you suggest we do? Should we take a break from it all?
So I think the first step is to make sure that the source of information is valid. WHO and the Ministry of Health of each country are the authorized informers for what is going on. So we really need to stick to that source of information. Then we need to make sure that we don't only focus on the negative, we need to ensure that we are looking into also the positive side, which is many people recover, many people are strong, and they're able to pass through this as something lighter than what we see. And then it is important for people who are confined at home to keep on their routines, to make sure that they have a healthy routine, they keep active as much as they can, and if they do not have enough routine, or their routine was so much disrupted because they're not going to work, to find new routines, to be more creative, to read more, to engage in communication with their friends and relatives through WhatsApp, Skype, keep in contact, don't self-isolate. It's very important at these times that we feel connected, even though we do have social distancing and we respect that, we still have all the means that we need to communicate. But then, of course, we also need to think about the elderly or people with disabilities, because if these people do not have access to internet or to the telecommunications that we normally use, we need to think about them, and we need to reach out to them in any way we can to share information, to explain in a way they would understand what is happening, and to try to engage them and socially be connected in any way that we can. So in this, when something like this happens, we tend to forget that there are people with pre-existing mental health conditions, people that already have burden, and the focus shifts immediately to something else, but that's wrong. We need to always think about these people.
And I know that you have a hotline number available, and you should be getting some more numbers. Who are you encouraging to call?
So this hotline is a hotline that is there to support the existing hotlines for medical causes when people need to talk about their symptoms. But if people are feeling anxious, if people are worried that they might fall sick but they don't have any symptoms, they still can call. We have set up a number, and we are trying to set up a second number. I will share the number that we have so far. It's 802-6525. And we will be sharing soon, hopefully by Saturday, we will have the second number, which we will try to share through ZNS radio station.
Well, thank you so much for being with us today, Dr. Spyridou.
Thank you.
Appreciate it.
Thank you.
Stay with us, there's more right after this.